Yes, so the next page. Our sustainable procurement policy at Auckland District Health Board features with four pillars: economic, environmental, social and cultural. And I'm just going to talk about cultural for a few minutes here, because that is a very strong theme that across all of the health sector, public health sector, and that's our Treaty of Waitangi responsibilities and acknowledging the Maori, the Indigenous people, and the importance of kaitiaki tanganga role and the spiritual links within the environment that strengthens our partnership to improve the health and environmental outcomes for Maori. Therefore, our Maori partners have a very deep understanding of their environment, therefore working together with them to help achieve their aspirations to be more unified in reducing the barriers and equities for Maori and reducing the impact of climate change. So we work with Maori as partners to create better outcomes for Maori and as well protecting the environment for future generations. That is a very, very strong focus within the Maori population, that we restore the environment to what it was 100 years ago. So our council drives that as well. So we align with these four key pillars in terms of how we approach sustainable procurement. Next slide, please. Oh, I wanted to, maybe this is a bit early in this discussion, but I just wanted to reflect what partnerships and collaboration look like for this organisation. And this is just a small sample of organisations that work with us. As partners, we collaborate together. They are external partners and as well as internal partners. They are suppliers, they are universities, they are academics, they are local agencies, they are ministries, they are also organisations not even related to health, for instance, animal health, which is really interesting because, and forest and birds. Now you wonder, why are these agencies working with Auckland District Health Board? Well, it's actually research, innovation, and also sharing information. It is very important to understand the impact we have on our environment, not on just the land, but the air and the water. So we work with everybody, we share information, we ask them to share their resources and bring together much more of an understanding of what we need to do in the broader context and the strategic pathway that we would need to follow to build capacity and capability and resilience within the organisation to take it forward for the next 20 years. Next slide, please. So what does sustainable procurement mean to us? It's a commitment. It is driven by our leadership, our senior leadership team from the top down. Our board is very, very focused and very committed to this. As I mentioned earlier, they're very committed to the Maori values and culture and kaitiaki tanga and stewardship. That is a very strong theme that runs across all of our discussions. We also have a bottom-up approach. We encourage scheme teams to drive the culture and change and create the change to make things happen. Communication, collaboration, partnerships, as I mentioned earlier. We work with anyone and everybody to progress our sustainable procurement program, because there are many, many moving parts to this, and from small items such as syringes to large ticket items such as machinery, clinical equipment, to beds, to air vents and infrastructure items. So innovation, creativity is a very, very big thing within the organisation that is encouraged. We also support staff and promote learning to enable them to lead, grow and flourish, and leaving no one behind, which is basically the principles of adopting the UN goals, and to promote health and well-being. So next slide, please. I want to talk a few minutes about our market tender criteria. And this came about 2 years ago. We were working with one of our partners, the Sustainable Business Network, and 2018, they provided us, working with them and a number of external businesses, they put together a question bank for sustainable procurement. And so back in 2018, we started the first tender document around sustainability. Now, the questions does differ depending on the type of product that you're procuring. So this particular case study, we've got 2 case studies that I'll talk to, where we ask the tenders, the applicants to look at to submit evidence of accreditation, products of the lifespan of products, how they deal with waste, the types of disposal methods, the types of materials they use, transportation, and also labour rights, human rights in terms of labour conditions, their safety records. So what are the challenges for us? The challenges during the COVID has been the changing priorities. We were going along very well with sustainable procurement, and then COVID happened. So all our focus was, the organisation was focused on patient care and PPE. And as a result, our waste volumes did actually increase quite significantly over the last 6 months as a result of this. But also, what it revealed is some gaps in our capability and our systems and processes. So, and what we've done since March, April, there's been a separate work group that's been set up to look at sustainable procurement in a much broader sense, and also developing systems, and also looking at undertaking a risk assessment of our sustainable supply chain. Where does sustainability sit in this? Well, all future tenders will look at how we adopt new practices and provide, and also encourage innovation amongst suppliers. Visibility, I talked about some of our gaps, is traceability, authentication, also visibility and consistent standards. And this is part of the learning for us, is understanding more about visibility and standards, also monitoring that as well on a regular basis. And hence our systems, we don't actually have the systems to manage this at the front end. So we need to do a further work around this, and this is going to take time. But the Healthcare Without Procurement guideline is actually an excellent tool for us to move that along. One of the problems we've had is also lowest price model, and that's a problem for us, because we feel that there's going to be some cost on adopting a much more sustainable option, and through innovation. So that is one of our challenges, and also one of our barriers, because our organisations are really cash strapped, and there's some financial constraints around that.